All right, guys, here we go. We are going to show you how to get on here from square one. So right behind here, you're going to see this power on button. Yep, we're going to push that button, power on. It took me a while yesterday. Shut up. Yeah. Don't judge.
Sorry, I'm pretty sure thought we knew how to turn it on.
Don't judge. Don't judge. Shannon's judging
I'm
me.
here judging.
All right, so it's going to power up.
So it takes about 7 to 10 seconds for it to power up, so you can always turn it off in between your patients, or you can leave it on. Don't do that, you know, she doesn't like that. So this over here is nerve setting, NRV, and it says high frequency linear, which would be this transducer right here, high frequency linear. So obviously when you're doing a lot of blocks, you're going to use that nerve setting, but you're going to want to switch to this one, which is called a curvilinear 60, C60. So we want to make sure we switch it. So right up here is transducer button. And until this comes across, you can't do anything. So we're going to hit transducer. We're going to hit switch. These are exam types or presets for the exams. So we want to make sure to do a bladder volume. We want to make sure that we're in the abdomen setting. More than likely, it's probably going to come up on nerve because that's what you guys are doing most of the time. So again, over here, nerve. So we want to make sure we switch to the abdomen setting. So we'll hit transducer. All the exam types come up. We're going to hit abdomen. It's going to come up. You'll see abdomen over here again. So what you're going to want to do is make sure that your patient is in the longitudinal scan plane. So that means that the orientation, this marker here, goes towards the patient's head, like this picture here. So we're going to get a longitudinal scan of the bladder. We want to make sure the symphysis is over here. So this is a longitudinal scan or sagittal, and this will be the AP measurement. So we're going to take a measurement from here to here. Then we're going to take a second measurement from the top to bottom. So we're going to practice that. So right now we're going to freeze, button down here, and then we're going to use calc. First thing we're going to do is go to volume, touch that distance 1. We're going to touch this, and I'll keep this up here for a reference if you need it. So again, this picture here, we're going to save calc down here. We're going to do volume 2, and we're going to do one like this. And that's going to be this measurement right here, and we're going to save calc. We're going to save this picture, okay, or you can print the picture, and you'll hear it beep. So we're going to go ahead and scan transversely now. You're going to see the difference here. This goes towards the patient's right, always when you're scanning. You want to make sure that you get down low enough. You can see here you're very far low towards the symphysis. And you're going to take this measurement from side to side. It's a transverse measurement. So we'll go back to the picture. We'll scan. We'll freeze. We'll hit our calipers. Nope, we want to hit calc. Distance 3. This one's going to be a side-to-side measurement like this, which is right here, side to side, and we're going to save that calc. Down here will be our volume now. And we're going to save that picture. So now we have our total volume that's in our patient, our fake patient here. So this person here probably has a good 300 to 400 cc's in their bladder. That is it. You want to end your patient now. So you want to go back to patient information, and you want to end your study right here, end. So now you're HIPAA compliant. All the pictures that you take are not going to be on somebody else's name, or in this case, we don't have a name at all. We can hit done. We can also review our pictures by hitting the review button over here. You see it's still working. This is a trackpad, so that moves it all around for you if you wanted to move it. You can always start a new patient just by hitting patient information. You can hit and type in whatever you want. No keyboard to clean, so all you have to do is touch this. Keyboard comes up, and you can put in information. You can hit next, or you can hit OK and then just touch it right here and then type in what you want. Type in an ID or birth date or whatever. As soon as you're done with that, you hit done. And now you're ready to have your patient's information. So now we can do this all over again. When it's blue like this over here, now it's gray, so it's perfect. So we're going to go ahead and pretend like we're scanning again in the longitudinal plane like this. So again, this goes towards the patient's head like this. So we'll freeze the picture. And we'll use caliper, volume 1, like this. Save calc, volume 2, distance 2. This will be the AP measurement. Save calc. Again, we'll unfreeze here. We'll rescan the patient. This goes towards the patient's right, like this. We'll get this picture right here. We'll freeze our picture. We'll hit calc one more time, volume 3 for distance. Save calc, and again, here's our volume down here. You can save your picture. Always, because this is a new patient, you want to make sure you end your study. So we're going to go ahead and unfreeze and hit patient, information, and end. Now that patient is completely out. If we want to review our pictures, we can touch review, and it'll come up here a list of all the patients you guys have done, but this is the one we just did. So we can hit review, and we can look at our pictures here. So that's nice to know too. If we want to delete those pictures, we could. Patient, review, you can hit review, 2 ways to do it. So we can hit those 2 patients that I just practiced on, and we can delete those. Yes, we want to delete it. And then we hit done. So this tells you how much is left on your hard drive. So again, you have about 98%. So you have a lot left on the hard drive. It's 16 gigs, so it does hold a lot. So you don't have to really worry until it gets down to like 50%. But you can always go back to patient, review, and then we can hit select all, and
delete all those?
we can delete all of them.
Okay.
We won't do that right now. We can hit clear all, so we don't delete them until you're ready.
Okay.
But that's it. That's Bladder 101.
And then can you put it back to nerve so that
Yep.
we
Show
know?
us how to go back.
Yeah.
So,
Transducer
transducer,
again.
anytime you get a transducer and you hit it, these are the exam types. We go ahead and hit nerve, and now it's back on the nerve setting.
Okay.
The problem is it's still on this transducer, is that correct?
Yes, it is. So if we want to switch to the high frequency linear, instead of having to swap it out on the back,
Yep.
hit transducer,
Yep.
and all we have to do is hit switch.
Perfect.
And then it's going to go back, and you're going to hit transducer one more time, and you'll see all the exam types that
make sure it's
transducer will
nerve,
do.
yeah.
Yeah, so it'll tell you if it's in the nerve setting right up here, which it will be, because whoever used it last, it'll be there for somebody up here. But if it's
High
not, you can hit
frequency, yeah.
transducer, and then these are all the exam types it'll do.
Okay.
If you were doing a central line, you could use a venous setting.
Okay.
Or doing a lung or something like that.
Perfect. Awesome. All right, guys. Thank you.